The technology of weapons to kill and maim people exponentially grew as civilizations warred against each other for power and the expansion of their territories. From sharpened sticks and spears to sophisticated and powerful guns, the destruction caused by weapons on humans created a need for better medical treatments. However, although artillery was the biggest killer in World War I, deaths were also attributed to diseases like influenza, pneumonia, trench fever, and inadequate wound care. Thus, a need for improved medical care became the focus of doctors and scientists during the war. Because of this dedication, medical advancements helped save lives during World War I through improved wound care, new methods to combat contagious diseases, and the development of innovative medical equipment. Improved wound care was critical in the dressing stations through the diligent use of antiseptics and constant cleaning, and with the increased use of blood transfusions. Improved wound care began initially by addressing the wounds in the forward area, known as the dressing station. The quickness of field emergency medics gave the injured party a better chance of survival. On November 9, 1914, the senior medical officer of HMS Sydney, Dr. Leonard Darby, recorded the types and numbers of injuries sustained by German sailors taken on board after their ship, the SMS Emden, sustained severe damage off the coast of Coco Islands in action with HMS Sydney. Darby maintained that although the medical staff worked tirelessly, they credited the use of several antiseptics for wound care and constant cleaning, specifically hand washing, in stabilizing patients. By using stringent antiseptics, Darby's medical staff stopped the growth of microbes on those patients injured in filthy conditions and kept infections down to a minimum. The refined use of blood transfusions became widely used during World War I. Oswald Robertson, who served in France with the United States Army Medical Corps, pioneered the collection and storage of blood in advance of battles and used the blood to stem the effects of exsanguination. Surgical patients also benefited from blood transfusions. Upon entering the surgical area, most patients had already had extensive blood loss from their wounds. In his autobiography, Dr. Geoffrey Keynes, a pioneer in the use of blood transfusion and who served as a surgeon in France through the war, noted, "Transfusion naturally provided an incomparable extension of the possibilities of life-saving surgery. The possibility of blood transfusion now raised the hopes where formerly there had not been any." Consequently, transfusions became a life-preserving procedure during the war. Also, according to E. Bolton and D. Roberts, however, later in the war, the scope of transfusions also included intra- and post-operative use, carbon monoxide poisoning, septicemia, and chronic wound infection. Although primarily used for extreme life-threatening blood loss, those patients with chronic wound infection benefited from a blood transfusion because hemoglobin, the protein that carries oxygen, helped restore blood to normal values, thus creating a better chance for patient survival. Contagious diseases plagued soldiers during World War I. New methods to combat diseases such as trench fever, influenza, and pneumonia became widespread during the war to better fight these infections. Later found to be carried by louse flies, trench fever spread in the trenches where tactical warfare occurred. Interestingly, trench fever, first discovered in 1915, later disappeared when the war ended in 1918. Drastically cold and warm weather extremes exacerbated conditions in the trenches. And because the soldiers could not build fires in the trenches for fear of exposure to the enemy, they sought warmth from their comrades during the cold winters. The louse infestation spread with this proximity to each other. After identifying the transmission agent, trench fever treatment became one of prevention by eradicating the louse through developed chemical insecticides. In 1918, a more insidious enemy struck, namely influenza. According to Carol R. Byerly, World War I and influenza collaborated. The war fostered disease by creating conditions in the trenches of France that some epidemiologists believed enabled the influenza virus to evolve into a killer of global proportions. To combat the influenza pandemic, doctors implemented preventative measures such as quarantining, mask wearing, social distancing, and experimental vaccines to stem the spread, unfortunately to no avail. Though there were many advancements in medicine during World War I, finding a treatment for the virulent nature of the influenza pandemic would have to wait until 2019, when COVID-19 struck the world populations and new therapies to counteract the virus, such as vaccines, were used. Because antibiotics would not be available for use until 20 years after World War I, many soldiers died from bacterial pneumonia. Bacterial pneumonia at this time carried a 40 to 50% mortality rate. Medical breakthroughs to treat pneumonia did not happen until after the war through antibiotics and vaccines to combat the bacteria. Because the death rates were lower than in the previous century, the preventative measures developed during the war were considered acceptable, even admirable, in controlling infectious diseases. In contrast, using a vaccine for tetanus was one of the great successes in Army medicine. Dirty open wounds were a breeding ground for tetanus, a bacteria usually found in soil and manure, both of which were plentiful during the war. The bacteria created debilitating symptoms and, left unchecked, could cause death. However, in the AEF, of 500,000 wounds and injuries, only 23 cases were recorded, with no deaths. This was in part due to the use of the tetanus antiserum. Historically, the argument stands that although other improved medical services contributed to the lower incidence of tetanus, injection of the antiserum was the deciding factor in effectively treating tetanus. The Thomas splint was an innovative piece of medical equipment developed during World War I to counteract the destructive effects of compound fractures, where the skin was broken and a large open wound was exposed. If not attended to immediately on the battlefield, soldiers died during transport to a medical facility. Before using the Thomas splint, 60% of British Army soldiers perished from complications of fractures received on the battlefield. With the invention of the splint, soldiers' bones were stabilized, which prevented infection. In addition, before using the Thomas splint, which is still in use today, leg amputations were carried out, which often was a death sentence for the injured soldier. The pioneering invention of the Thomas splint during the war was a testament to groundbreaking technological breakthroughs that helped to save lives. Used as early as 1895, X-ray technology became a standard diagnostic tool for physicians in hospital settings to investigate the skeleton, lungs, and other organs. However, during World War I, advances in X-ray equipment and mobile delivery of X-ray units to field hospitals became instrumental to the early diagnosis and treatment of wounded soldiers. Medical radiology played an important role in helping to conserve the fighting strength of American military forces, and the medical experiences during World War I contributed significantly toward the development of the profession of radiology. The massive amounts of casualties created stressful conditions on technicians and equipment. A portable X-ray field unit developed by Dr. William Coolidge, a noted inventor who held an honorary medical degree, was used to solve demanding problems created by overwhelming numbers of soldier injuries. Thus, Once developed and implemented, the portable field X-ray unit proved invaluable on the battlefield in a variety of situations involving the supply of electricity for lights during surgery and trench warfare, in addition to its primary medical functions. The invention and use of portable X-ray units was a prime example of, as the needs arose, individuals stepped up to confront and solve wartime medical problems on the battlefield. When World War I finally ended, the death toll reflected how devastating it was. The total war casualties were approximately 20 million. Although artillery was the biggest killer, diseases like influenza, pneumonia, trench fever, and inadequate wound care contributed to the high death toll. World War I inflicted death, disease, and permanently disabled injuries on soldiers. However, through the combined efforts of individuals, medical advancements during World War I, though taken for granted today, contributed to saving lives. The medical innovations used in World War I prompted additional research and developments in the discovery of antibiotics, emergency medical triage protocols, life-saving facial surgery techniques, vaccines, and more potent antiseptics. Moreover, these fantastic developments and pioneering procedures and methods paved the way for future medical discoveries that continue to benefit today's society.